So just while Sharita's bringing it up, let me introduce Kathleen McLean. She's an environmental health scientist with over 10 years of experience in environmental health research and surveillance. She has worked for the last 5 years in environmental health services at the BC Centre for Disease Control, exploring how environmental exposures, including wildfire smoke, extreme heat, and industrial air pollution, affect population health in BC. Kathleen holds a bachelor's degree in chemical and biological engineering and is a master's degree in public health. So welcome, Kathleen, and it looks like your presentation's up on the screen. So please go ahead. Thank you.
All right, so thanks for having me. If you can flip to the next slide. So just before I start, I'd like to acknowledge Sarah Henderson and Angela Yao. They kindly let me borrow a bunch of their slides, and they've also been leading or involved in all of this work, really. So next slide. So anyone who's been around in BC for the past couple of summers knows that 2017 and 2018 were very intense, record-breaking wildfire seasons that were both very smoky. So in this figure, we have PM 2.5, or fine particulate matter concentrations that have been population weighted. So this represents sort of an average exposure for every person in BC over these years. So in 2016, we had a fairly mild wildfire season in comparison to the other two. You can see the gray line at the bottom. It's, fairly low exposure for the entire period, and there's not a lot of variability. But in 2017 and 2018, we had a 6 to 8 week period in both of those summers where PM exposures were high really across the province. And 2018 was actually a little bit worse than 2017. The PM 2.5 exposures peaked at a higher concentration in 2018 compared with 2017. And in the lower mainland, we were under an air quality advisory for a higher number of days in 2018 than we were in 2017. It's impossible to say what's going to happen this year, except it seems increasingly likely that we are in for another intense wildfire season. It's been a drier and warmer spring than normal. Snowpacks and river flows across the province are well below normal. There's drought conditions in parts of the province, and so all of those factors mean that the fuels in the forest are dry, and so really what happens depends on the weather conditions over the summer, as well as how many fires are started due to lightning or humans. So we'll see what happens, but I would say this is a great time to prepare for the worst while hoping for the best. So next slide. So we're talking about wildfire smoke today, and wildfire smoke is a complex form of air pollution. We most often talk about fine particulate matter. It's measured across the province, and it's also of large concern with regard to health. But there's many other pollutants in wildfire smoke, such as carbon monoxide, oxides of nitrogen and sulfur. There's volatile organic compounds such as benzene and formaldehyde, and there are heavy metals, secondary ozone, and other things. And wildfire smoke is also quite dynamic. So the different components in wildfire smoke can be present in different concentrations depending on a number of factors, such as the fuel type, the moisture content of those fuels, the burn temperature. So a smoldering fire produces different smoke than a flaming fire. The meteorological conditions have an impact, and as well how far the smoke is away from the fire. So things can change in the smoke as it moves away from the fire. So next slide. So in this drawing, we get a sense of the size and the shape of the particles that are in wildfire smoke. So in the bottom left-hand corner, there's a human hair for scale that's about 50 micrometers in diameter. The blue spheres they represent PM10, which are 10 micrometers in diameter or less. The pink spheres show the relative size of PM 2.5, and then there are plenty of other particles that are smaller than that. And so the very, very small particles can kind of clump together and form these larger particles that end up being 2.5 micrometers in diameter or up to, all the other sizes. And one of the key things is to note that the shape of these particles isn't just a nice smooth sphere. They're kind of 3D irregular shapes with all these different particles that have clumped together. And so from a health perspective, when these particles when you breathe them in, they can go deep into your lungs, especially the really, really small ones. And your body interprets them as a foreign invader, just as it would a bacterium or a virus. And so it tries to kill these particles just as it would a bacterium or a virus. And so that's mounting an immunological attack against them. And because it can't kill them, then the immune response is sustained, and that can lead to a state of elevated inflammation in your body. So that's kind of the mechanism behind some of the health effects. Also, volatile organic compounds can be quite irritating to the respiratory tract in the lungs and all that. So if we go to the next slide. So because of these effects on health, we see kind of a range of health outcomes in the population. And so most people, if you're healthy, which is healthy people is kind of a large proportion of the population, when it's smoky, most of the effects are fairly minor, so that state of inflammation can be tolerated fairly easily. So yeah, for healthy people, you might get a headache or a sore throat or a runny nose, or like I remember a couple of summers ago during the smoke, I just felt a bit fatigued or just a little bit off. But as we move up this pyramid, the proportion of the population affected by these different health outcomes gets smaller, but the severity of the effects are more severe. So next slide. So some of the biggest effects are on breathing. So people with asthma or chronic obstructive pulmonary disease can have exacerbations of their illness when it's smoky. And we can really see this when we look at data from the provincial healthcare system. So on the left-hand side, we have dispensations of Ventolin in the province, comparing 2017 and 2018 combined with 2016, which was not a very intense wildfire season. And so you can see that that we had an almost 40% increase in dispensations of Ventolin. So that's a rescue medication that asthmatics or people with COPD would use to control their symptoms. And so that's about 43,000 extra puffers dispensed during the intense wildfire seasons. And on the other side, we have physician visits for asthma. And so in 2017 and 2018, there was about a 20% increase in physician visits for asthma compared with 2016, or about 10,000 extra visits. So the population with asthma and COPD are quite reactive to smoke exposure, and we can see these effects visually without having to do any kind of fancy statistics with the data. So next slide. So the most severe effects from the tip of that pyramid that we saw before affect only a small proportion of the population, and they're harder to detect. We can only see it when we perform statistical analyses on the data. And so one of those effects is mortality. So when it's like on a very smoky day in a population of about 1 million people, we would expect about 2 to 4 excess deaths. And we suspect that those 2 to 4 excess deaths are mostly cardiovascular deaths, and that's becoming clearer as there's more evidence about this. So although there's quite a big impact on respiratory health and morbidity, that's not necessarily leading to an increase in respiratory mortality. But we do see an increase in out-of-hospital cardiac arrests, as well as heart attacks and stroke. And those are, severe health events that can lead to mortality, and they can have long-term implications for people who experience them and do survive. So next slide. So there's a number of groups that we consider to be most susceptible to the health effects from wildfire smoke exposure. And we've already talked about the first two. So those are people with chronic respiratory disease and people with chronic cardiovascular disease. Pregnant women are also a concern. There's some evidence that women who are exposed to smoke during pregnancy, their babies might be a little bit smaller than, born a little bit smaller than women who were not exposed to wildfire smoke. It's a small effect, but it can have impacts, and so that's something that there's going to continue to be research on. Also, infants and young children are at risk. Their respiratory systems are still developing, and they also breathe at a faster rate than adults. So they're also considered a vulnerable group. And the elderly are also a vulnerable group. And so when you add up all these groups within a standard population, it's actually about a third of the population that falls into all of these groups that are considered susceptible to the health effects of wildfire smoke. So it's not really just a small proportion of the population. So next slide. So what can we do as individuals and communities to prepare and respond to wildfire smoke? Next slide. So we all have to breathe, but we can reduce risk by trying to breathe less smoke. Next slide. So most people spend most of their time indoors, and so cleaner air is the first line of defense. This is a study that looked at the use of a portable air cleaner during the 2003 wildfires in BC. The black line is the outdoor PM 2.5 concentration, and the gray line is the indoor PM 2.5 concentration. So on the left-hand side of the figure, before the air filter was turned on, you can see that the indoor and outdoor concentrations track fairly well. They go up and down around the same time. And then the vertical black line is when the filter was turned on, and so you can see that after that, the indoor concentration stayed low, while the outdoor concentration continued to fluctuate. So individuals can purchase portable air cleaners for their homes as a way to prepare for the wildfire season. Or if someone has a forced air system, they can talk to their service provider about using a special filter or settings on their system. However, we know that not everyone can afford to purchase these solutions. So one way to help people might be for community groups or other organizations to purchase air cleaners that they could either give away or lend out to vulnerable members of the community. Next slide. And another option is to create clean air shelters in communities. So these can be libraries, community centers, shopping malls, and swimming pools. And these kinds of facilities tend to have, heating and ventilation systems that can handle filters that can remove pollutants from the air. And there are municipalities in BC that are doing the work to identify these types of spaces, to work with engineers to get their ventilation systems with their filters installed and making them available to people so that they have a refuge from the smoke. Next slide. So another way to reduce exposure is to try to just breathe less smoke by not breathing as much. And so this is about exertion. So when you're sitting around resting, you breathe about 7 liters of air per minute. But once you start to exert yourself, you breathe more deeply and more frequently. And so jogging, if you're jogging, you breathe about 70 liters of air per minute, and running is about 110 liters of air per minute. So this graph just shows some different scenarios, assuming a particular outdoor PM concentration, a particular indoor PM concentration, and then some different scenarios about what you're doing. So the very bottom is 24 hours resting indoors, and there's a particular massive PM that you would breathe in under that scenario. The next one up is 22 hours resting indoors and taking a 2-hour indoor walk. The next one up is replacing that indoor walk with an indoor jog. Next up is replacing that 2-hour indoor jog with a 2-hour indoor run. Next up is replacing the 2-hour indoor run with a 2-hour outdoor walk. Next, a 2-hour outdoor jog. The second from the top is 24 hours resting outdoors, and then the top line, the worst exposure scenario, is 22 hours resting indoors and a 2-hour outdoor run. So the takeaway from this is we still want people exercising because that's important for health and wellness, but take it easy if it's smoky outside, and consider exercising indoors. So finding cleaner indoor air, staying indoors when possible, and taking it easy when exercising are kind of our main recommendations for reducing exposure. Next slide. There are other interventions that can be undertaken. So this is a document that's available on the BCCDC website on the Wildfire Smoke Response Planning page. It provides guidance for BC public health decision makers during wildfire smoke events. And so it covers some of the stuff I've talked about today and also some other stuff. So that's available if people want to dive into this a bit more. Next slide. And also new this year we have a series of fact sheets coming out about wildfire smoke and your health. And I actually have a few of them here today. So if anybody wants to take some copies of a few of these fact sheets with you, please come and see me afterwards. The titles in blue are available right now on the website, and the titles in black are planned and will be coming out sometime in the future. Next slide. So wildfires are here to stay. The fact is we live in a fire-prone landscape. And fire is a natural phenomenon, and frequent low-intensity fires can be a beneficial force in the forest by cleaning the forest floor, providing habitat for certain species, killing disease and insect infestations, and regenerating the forest. There are some factors in history, like our history of wildfire suppression and also the amount of logging we have in the province, means that we have a lot of fuel buildup in the forest, so that's part of what's increased the risk for the kind of high-intensity wildfires that we've seen, and also climate change, of course, is a very big factor. We're having summers that are longer and drier, which causes all these fuels to dry out earlier and stay dry longer. So prescribed fires are used by the BC Wildfire Service to reduce wildfire risk, or at least reduce the risk of the high-intensity wildfires that tend to get out of control. But arguably they would need to do a lot more to kind of reduce wildfire risk across the province. But prescribed fires also create smoke, and so the question is, what else can we do to prevent fire? So next slide. So I wanted to show this, especially since you are a group of people interested in the built environment, and this is the graphical abstract from a paper by David Bowman, Sarah Henderson, and other colleagues from BC, Australia, and the US. And so they envision that the effects of smoke pollution on public health can motivate changes in fuels management, the built environment, and community engagement in order to achieve a more sustainable coexistence with our flammable landscapes. So they asked some questions like, could we use mechanical thinning in addition to prescribed fire to favor the lower intensity wildfires that can be left to burn in uninhabited areas and that would be less costly to manage in inhabited areas? They asked, instead of burning woody debris in piles, could we instead find ways to use the woody debris that is left over from logging or removed during mechanical thinning for the production of bioenergy? Instead of having, properties like the, little house in the big woods surrounded closely by trees, could we use appropriate landscaping and fire-resistant materials? Could we replace inefficient wood stoves with efficient wood stoves or pellet stoves? And could we use bioenergy for electricity generation in some of the areas that are right on the wildland-urban interface? And if we could pull all of this off, urban environment would become cleaner due to reduced smoke from wildfires, prescribed fires, and residential wood burning. And, could we be better prepared through improved public health communications and promotion of effective portable air cleaners? And so some of this stuff is already happening. But I leave this as more food for thought for what else could be done across the province. Yeah, and the idea is that more fire-resilient communities and a less combustible wildland-urban interface would provide greater opportunity for, the wildfires that start naturally through lightning. We could just maybe let them burn in the wildlands without demanding large-scale and costly fire suppression. So that's what I've got to say, and I'm happy